Tomorrow onwards, we decided we will have the class 6 to 8, but you log in at 5 o'clock itself. From 5 to 6, we will have about 80 questions which run like a quiz, every question changing every 30 seconds. And you being a community, now a very strong community, you can start plugging in your answers. Others will start contributing their explanations or anything. So you solve as a group those 80 questions from 5 to 6, and 6 to 8 we will have the interactive session where I will come down. So that is going to be the plan. Similarly, the Sunday exam also, morning 9 to 12, 300 questions which are given in the mock test will come like a every 30 seconds or 40 seconds a question changing, and you can punch your answers and get ready with your answers. So that is how we will plan it. That's good. Generally we get good ideas only, ideas that help you all, right? So let's continue. 34-year-old has received marijuana and he is having ST depression. Ravi's opening answer was clean bold. Chandan Singh says A, no. Always remember one thing, doctor. If you want to give streptokinase or you want to do a revascularization, what is the indication? ST segment elevation. But here what you have is a ST segment depression, which is a marker of ischemia, whereas ST segment elevation is a marker of a significant amount of infarction. So that is what you have to basically differentiate. So that is the reason, except for giving aspirin, there is not much to do in this given case, as Akshay Chugh has rightly said. 29-year-old comes for evaluation of his abnormal EKG, and the EKG has been shown to you. So what is the speciality of this EKG, doctor? There is a P wave QRS, P wave QRS. Progressively the PR interval is lengthening until the Q wave has dropped down. So the patient is having a symptomatic AV block with a prolonged interval, but still there is no dropped beat. So it can be seen sometimes in healthy people, so it does not require any active intervention, is what need to be remembered. You have two kinds, Mobitz type 1, Mobitz type 2 block. Please give me the board. So this is one funda which you should be very clear and sure about, doctor. You have P QRS T wave. So starting of the P to the QRS is the PR interval. So PR interval only prolonged, that's called first degree. Second degree block, P QRS T. P but a little delayed, QRS T. Then P more delayed, QRS T. And after that there is only P, there is no QRS. What is this called? Second degree heart block. In second degree heart block there are two kinds, Mobitz type 1, Mobitz type 2. What is the meaning of Mobitz type 1? With every beat the PR interval is prolonging more and more until there is a point where after the P there is no QRS, there is a dropped beat. Such a serial prolongation of the PR interval with every beat until a missed QRS is there, that is called as Mobitz type 1. Whereas what is Mobitz type 2? P QRS, P QRS, P QRS. After that only P, no QRS, no QRS. So suddenly there is a drop of QRS, which is called the Mobitz type 2 without Wenckebach phenomena, is called Mobitz type 2. What is the favorite question of the examiner? Where do you want a pacemaker? Which type of block is an indication for pacemaker? Suppose, what is Wenckebach phenomena? The boy and girl are loving each other. After some time, the girl stopped responding to WhatsApp messages. After that, she has put a block of WhatsApp messages. After that, even on Facebook, she removed her profile. By this time, the boy should understand that he is going to get a dropped QRS. Still, if he did not understand, then he is definitely the dumbest creature on the planet. Whereas, what is Mobitz type 2 block? The boy and girl studying together, the same page in the horizon. The boy and girl together, like the P and QRS, are going to the tea stall outside reading room. But one day, suddenly the girl came and said that my father decided marriage with a USMLE passed out boy. I'm going to America. Bye-bye. Don't call me anymore. Suddenly, what will happen to the boy? He will go into a cardiac arrest. So that is Mobitz type 2. Which is more dangerous, doctor? Mobitz type 2 is more dangerous, where pacemaker is indicated in case of the Mobitz type 2 and complete heart block. These are the two situations. In complete heart block, there is a complete AV dissociation. Atria beating at its own style, ventricle develops a idioventricular rhythm and beats at its own style. There also you require a pacemaker. So Mobitz type 2 and the Mobitz and the complete heart block are the indication for the pacemaker is what need to be remembered. Now doctor, a 25-year-old woman presents with the pelvic pain, vaginal discharge, cervical motion tenderness and a palpable tender left-sided adnexal mass is there. So what is your answer? One strong classical example, classical answer. So what do you want? What do you think with this given history where she has a purulent vaginal discharge, cervical motion tenderness and a palpable tender left-sided adnexal mass? So what is your answer about this case? Ravi, Akshay, Arthi, Anjum, 142 online students, very happy to see all of you. Sudhakar, everyone is saying A versus B. Only Anjum said it is C. Very good. If unruptured, the rupture of the mass and secondary peritonitis can occur. So what is this important clinical sign where someone who has got a pelvic inflammatory disease, if you happen to cause a cervical motion, it will be extreme tenderness. What is that called? Chandelier sign. Why it is called chandelier sign? In pelvic inflammatory disease, if you try to do a pervaginal examination and try to touch the cervix, the woman will kick you off the table that you have to go and hold the chandelier. So that is the reason, actually also that is the reason they call chandelier sign. So don't try to venture out to do a pervaginal examination in a most potential case of pelvic inflammatory disease is a very important rule. Chandelier sign. So the patient is having a tubo-ovarian mass which presents like a adnexal mass in case of a pelvic inflammatory disease, and generally it is a mixed infection, both gonorrhea, chlamydia. That's the reason you have to treat them with ampicillin, clindamycin, gentamicin. Combination is considered to be the management of choice is what you need to remember. Then once more, if the abscess size is 4 to 6 centimeters, tubo-ovarian abscess, most of the times antibiotics will take it. But if more than 10 centimeters, then it requires surgical intervention, which is considered to be the management of choice is what need to be remembered.